name's Ravi Mutke, and I'm a general surgeon and a colon and rectal surgeon. Well, it's surgery on the intestine, so it can be the small intestine, the colon, and the rectum. The rectum's the tail end of the colon. I chose it because it can be challenging, but also because it's a very successful field of surgery, which is to say most problems that affect people who have problems with the colon and rectum have very satisfactory surgical solutions. We can almost always operate on the colon and rectum through very small incisions. And even more recently, we've increased our use of the surgical robot in the treatment of the rectum in particular. It's a very sophisticated piece of machinery that allows us to operate deep in the pelvis where the rectum lives with the same kind of precision and vision that we used to have with open surgery. I enjoy just about every part of my job. I suppose one of the things that attracts surgeons to surgery is the operation, and I do like that. It's very satisfying to have done an operation properly, particularly sometimes when it's challenging. But I like meeting patients in the clinic too. I like finding out about their lives. I like being able to answer their questions and offer them some solutions to something that's been bothering them for some period of time. I like seeing patients in the hospital. So I would say I enjoy almost every part of my job. Well, a lot of the serious problems that we're talking about, cancer, inflammatory bowel disease, have different ways of being treated, or sometimes the best treatment involves combining 3 or 4 different modalities of treatment. And so those doctors obviously have to be talking to each other for you to get the best treatment possible. Also, there's a bunch of doctors looking after you that you never meet when you're a patient. I mean, I'm talking here mostly about pathologists and radiologists. They're looking at slides of biopsies or looking at x-rays. And we talk on the phone or we talk side by side looking at slides or looking at x-rays so that we get the best possible understanding